Cystitis, a common urinary tract infection, presents a frequent challenge for primary care physicians. This condition, primarily affecting women, can significantly impact a patient's quality of life if not diagnosed and managed effectively. Understanding the intricacies of cystitis is paramount for accurate diagnosis, appropriate treatment, and effective patient education. Primary care physicians need to stay abreast of the latest guidelines and best practices for managing cystitis. From recognizing subtle variations in clinical presentations to navigating the complexities of antibiotic resistance, a comprehensive understanding of cystitis is essential. This knowledge empowers physicians to provide compassionate and patient-centered care. Cystitis, an inflammation of the bladder commonly caused by a bacterial infection, is a frequent reason for patients to seek medical attention. While often perceived as a straightforward condition, cystitis can present with a wide range of symptoms and varying degrees of severity. Misconceptions surrounding cystitis can contribute to inappropriate antibiotic use. This, in turn, fuels the growing concern of antibiotic resistance, a significant threat to global health. Primary care physicians play a crucial role in promoting antibiotic stewardship by accurately diagnosing cystitis and ensuring that antibiotics are prescribed only when necessary. By adopting an evidence-based approach, we can optimize patient care and contribute to better health outcomes. This masterclass on cystitis is meticulously structured to provide a comprehensive and practical guide for primary care physicians. We will embark on a journey that covers the essential aspects of cystitis, from its fundamental principles to the nuances of diagnosis and management. Our exploration begins with the foundational understanding of cystitis, delving into its epidemiology and the risk factors that predispose individuals to this troublesome infection. By understanding the factors that contribute to its development, we can better identify at-risk individuals and implement preventive measures. We will focus on managing cystitis, emphasizing evidence-based practices and current guidelines, discussing various antibiotic options and their appropriate use in different clinical scenarios, delving into non-pharmacological approaches, including lifestyle modifications and behavioral therapies, empowering patients to manage their condition proactively to reduce recurrence rates, addressing unique challenges in managing cystitis in pregnant women, postmenopausal women, men, and catheterized patients. Cystitis, a ubiquitous health concern, affects millions of individuals worldwide, placing a significant burden on healthcare systems and impacting the quality of life for countless individuals. This section delves into the epidemiological landscape of cystitis, highlighting its global prevalence and the populations most affected. Studies consistently demonstrate that cystitis is far more common in women than in men, a disparity largely attributed to anatomical differences in the urinary tract. It is estimated that approximately 50 to 60% of adult women will experience at least one episode of cystitis in their lifetime, a staggering statistic that underscores the need for heightened awareness and proactive management strategies. To effectively address the challenges posed by cystitis, it is imperative to delve into the factors that increase an individual's vulnerability to this common infection. While anatomical differences between men and women play a significant role, a myriad of other risk factors contributes to the development of cystitis. This section explores these risk factors, providing primary care physicians with valuable insights to guide patient education, risk assessment, and personalized management strategies. Intercourse can introduce bacteria into the urethra, increasing the likelihood of infection, a phenomenon often referred to as honeymoon cystitis. The high prevalence of cystitis, coupled with its diverse risk factors, underscores the crucial role of primary care physicians. Understanding trends and risk factors, physicians can tailor their approach, considering unique circumstances and history. This personalized approach is essential. Addressing symptoms and underlying factors helps manage recurrent infections. Patient education empowers health management, Open communication dispels myths, alleviates anxieties, and encourages adherence. To understand cystitis, we must trace bacterial invaders breaching the body's defenses. Cystitis often arises from bacteria entering the urinary tract through the urethra. The female anatomy, with a shorter urethra near the anus, increases susceptibility. Urine flow acts as a natural flushing mechanism, washing away potential invaders. Escherichia coli, or E. coli, is the primary culprit in cystitis. This bacterium, usually harmless in the intestines, can adapt to the urinary tract. E. coli's dominance in cystitis is due to its prevalence in fecal flora, proximity to the urethra, and virulence factors that enable colonization and invasion. While Escherichia coli reigns supreme as the primary antagonist in the vast majority of cystitis cases, it is not the sole perpetrator in this intricate microbial drama. A supporting cast of other bacterial species, often lurking in the shadows, can also seize the opportunity to invade the urinary tract, particularly when host defenses are compromised. Among these opportunistic pathogens, Staphylococcus saprophyticus, a bacterium commonly found on the skin and in the genital area, emerges as a noteworthy contender, particularly in young sexually active women. Klebsiella pneumoniae, Proteus mirabilis, and Enterococcus faecalis, all inhabitants of the intestinal tract, can also contribute to cystitis, albeit less frequently than their E. coli counterpart. Recognizing the telltale signs. Classic symptoms of cystitis. Cystitis typically announces its presence with a constellation of bothersome urinary symptoms, often sending patients seeking relief from the discomfort and disruption to their daily routines. While the intensity and combination of symptoms can vary from person to person, recognizing the classic presentation of cystitis is crucial for primary care physicians tasked with its prompt diagnosis and management. Dysuria, a pain or burning sensation during urination, often takes center stage in the symptom complex of cystitis. The mere anticipation of this discomfort can lead to anxiety and hesitation, further exacerbating the unpleasant experience of urination. Beyond the usual suspects, atypical presentations, and subtle clues. Recognizing cystitis can be challenging due to its atypical presentations, especially in older adults. Symptoms may be subtle, like confusion or falls, rather than classic urinary complaints. The importance of thorough history taking, unveiling the patient's story. In the realm of clinical medicine, where the pursuit of diagnosis often resembles detective work, a thorough and insightful history stands as the cornerstone of unraveling the mysteries of a patient's ailment. This principle holds particularly true in the case of cystitis, where the patient's narrative, rich with clues and nuances, provides invaluable guidance in navigating the diagnostic pathway and tailoring an effective management plan. The initial inquiry should focus on characterizing the nature and duration of the patient's urinary symptoms, exploring the onset, frequency, intensity, and any aggravating or relieving factors. In the realm of medicine, where scientific knowledge intersects with the art of healing, the patient's story serves as a compass, guiding the clinician toward an accurate diagnosis and an effective treatment plan. The journey of diagnosing cystitis begins with the patient's own words, their description of the discomfort and disruption that brought them to seek medical attention. Active listening, a cornerstone of patient-centered care, forms the foundation of this process, allowing the clinician to glean not only the specific details of the patient's symptoms, but also the emotional impact of their condition. While the patient's history lays the groundwork for understanding their condition, the physical examination provides an opportunity to gather objective data, corroborating their subjective complaints and uncovering any underlying physical findings that might contribute to their symptoms. In the evaluation of suspected cystitis, the physical examination should be targeted, focusing on the abdomen and pelvic region, with careful attention to signs of tenderness, distension, or masses. The abdominal examination typically begins with inspection, observing the contour of the abdomen, noting any asymmetry, scars, or distension. In the pursuit of a definitive cystitis diagnosis, laboratory investigations serve as invaluable tools, providing objective evidence to confirm or refute clinical suspicion and guide treatment decisions. These investigations, ranging from the readily available urinalysis to the more specialized urine culture, offer a glimpse into the microscopic world of the urinary tract, unmasking the presence of infection and identifying the culprit microorganisms responsible for the patient's discomfort. Urinalysis, a cornerstone of cystitis evaluation, provides a rapid and cost-effective means of detecting the telltale signs of inflammation and infection within the urinary tract. The art of differentiation, distinguishing cystitis from mimics. In the realm of clinical medicine, where symptoms often overlap and diagnostic certainty can be elusive, the ability to differentiate between similar appearing conditions is paramount. This principle holds particularly true in the evaluation of suspected cystitis, as its constellation of urinary symptoms can mimic a range of other conditions, some benign and self-limiting, others warranting specific and potentially urgent interventions. This section delves into the art of differential diagnosis, highlighting key conditions that can masquerade as cystitis and outlining strategies for accurate discernment. Considering common culprits, a systematic approach. Navigating differential diagnosis requires a systematic approach, considering each potential contender and weighing the evidence. This begins with a thorough history, detailing the onset, duration, and character of symptoms. The physical exam provides further clues, uncovering findings that support or refute a diagnosis. Laboratory investigations confirm or refute infections, identifying microorganisms and guiding treatment. Vaginitis often mimics cystitis with dysuria and urinary frequency. However, vaginitis presents with additional symptoms like vaginal itching, burning, and abnormal discharge. The discharge varies from thick and white in yeast infections to thin and grayish in bacterial vaginosis. General measures. First line of defense and patient education. A multifaceted approach addresses both symptoms and underlying factors in cystitis management. General measures, including lifestyle changes and over-the-counter remedies, are crucial. Patient education and empowerment are key to effective cystitis management. Increasing fluid intake is a simple, effective strategy. Hydration helps flush out the urinary tract, reducing bacteria. Encourage patients to drink water for clear or pale yellow urine. Section 2. Antibiotic stewardship. Choosing wisely, targeting effectively. Antibiotics are crucial for cystitis treatment, but have fueled antibiotic resistance, a global health threat. Antibiotic stewardship optimizes use and minimizes resistance. Selecting the right antibiotic involves balancing the causative organism, resistance patterns, and patient factors. First-line choices for uncomplicated cystitis include nitrofurantoin, trimethoprim sulfamethoxazole, and fosfomycin. Section 3. Tailoring treatment. Complicated cystitis and recurrent infections. Complicated cystitis, often due to underlying conditions or recurrent infections, requires a tailored approach. Longer antibiotic courses, guided by urine culture and susceptibility testing, are essential. Section 1. Unique considerations. Cystitis in specific patient populations. Cystitis can present unique challenges in certain patient populations. These include pregnant women, postmenopausal women, men, and catheterized patients. Tailored management strategies are essential. This section explores key considerations for optimizing care. Pregnancy alters the urinary tract, increasing cystitis risk. The enlarging uterus can compress the bladder. Hormonal shifts can disrupt the vaginal flora. Section 2. Potential pitfalls. Recognizing and managing complications. Cystitis can progress to serious complications if left untreated. Recognizing pitfalls and implementing interventions is crucial for minimizing morbidity. This section explores cystitis complications, warning signs, and management strategies. Pyelonephritis, an infection ascending to the kidneys, is a significant complication. Characterized by high fever, chills, and flank pain, it requires prompt medical attention. Section 1. Empowering primary care physicians. Mastering cystitis management. Cystitis, a frequent visitor to primary care settings, often presents as a seemingly straightforward condition. However, as we have explored throughout this comprehensive masterclass, the nuances of its diagnosis, treatment, and long-term management require a multifaceted approach, blending scientific knowledge with clinical acumen and a deep understanding of the patient's unique circumstances. By arming themselves with the latest evidence-based guidelines, a keen eye for subtle presentations, and a compassionate approach to patient care, primary care physicians can confidently navigate the complexities of cystitis, ensuring timely interventions and optimal outcomes for their patients. Section 2. Looking ahead. Advancements and ongoing challenges. As we conclude this exploration of cystitis, it is essential to acknowledge ongoing advancements and persistent challenges. Medicine constantly evolves with new research, tools, and therapies shaping patient care. Promising research focuses on alternative treatments for cystitis, addressing antibiotic resistance. Antibiotic resistance drives the search for innovative approaches to combat bacterial infections. Section 3. A collaborative approach. Partnering with patients for optimal outcomes. In the realm of healthcare, where scientific knowledge intersects with the art of healing, the patient-physician relationship stands as a cornerstone of effective care. This collaborative partnership, built on trust, open communication, and shared decision-making, empowers patients to actively participate in their health journey, fostering a sense of ownership and control over their well-being. Cystitis management, with its emphasis on lifestyle modifications, behavioral therapies, and long-term preventative strategies, particularly benefits from this collaborative approach, as patient adherence and engagement play a crucial role in achieving optimal outcomes.